How far would you go to save the love of your life?
Well, the answer is simple for this woman right here, whose husband is severely sick with COVID. Scott Quitter had been hospitalized since October in Minnesota, and doctors wanted to take him off the ventilator. But his wife fought in court to prevent that. She won and had her husband transferred 1,000 miles away to a hospital right here in Texas. And tonight, we're speaking with a Houston doctor known for taking in out-of-state and sometimes out-of-country COVID transfers. ABC 13's Shelley Childers talked with UMMC Dr. Joseph Varon about the desperate lengths families are taking to save their loved ones and why they're turning to him. Shelley?
Well, Dr. Varon has become a common name in the world of COVID treatment, helping to co-develop what he describes as a COVID cocktail that uses the controversial drug ivermectin. Still, hundreds of families have turned to him in their desperate time of need.
We are all stressed out.
He first made headlines for working more than 280 days straight at the start of the pandemic.
We're working 20 hours a day.
And today, Dr. Joseph Varon is still counting.
We've been doing this for 671 days as of today.
This time, tallying the number of days he's been using his own COVID treatment methods.
We offer a treatment that we know makes a difference in the outcome of patients with COVID.
It's a treatment that has at times put him at odds in the world of medicine, but has also garnered attention from desperate families.
They're in a situation where their family member is very sick, and you can see their pain.
He says hundreds of COVID patients from across the U.S. and Mexico have transferred to him, coming in by ambulance, medical flight, helicopter, and even personal car.
And we recently had a gentleman that drove from Montana. I mean, he got on his car, drove from Montana, and came to us because he wanted to be treated by our hospital.
Traveling to United Memorial Medical Center seeking treatment he says most other practitioners are not offering. Co-developed with 4 other colleagues, he says they use steroids, vitamins, blood thinners, and yes, ivermectin.
We use ivermectin in conjunction with all of these agents. And then we use zinc, we use melatonin.
He says they have a high success rate.
Our published mortality, which we published it on the year 2020, was 4.4%, when the rest of the country was at 25%.
He says he does not have their 2021 data yet. And these hundreds of patients coming in, he says, often in critical care, are 95% unvaccinated.
I'm not going to beat them up because they did not get vaccinated. That was a choice that they made. And I am going to take care of them the same way I would take care of, somebody with an alcoholic condition or some other condition.
Shelley Childers, ABC 13 Eyewitness News.